Have you ever gone to bed thinking you're doing everything right, only to wake up feeling tired, heavy, or uneasy without knowing why? What if the silent habits in the final 60 minutes before you sleep are putting your heart under deadly pressure, especially if you're over 60? In this video, we uncover the shocking bedtime mistakes millions of Americans make every night. Mistakes linked to nighttime blood pressure surges, irregular heart rhythms, and even early signs of heart failure. You'll discover simple, science-backed adjustments to your nightly routine that can protect your heart and transform how you feel every morning. Watch until the end to learn life-saving strategies that could save your heart, starting tonight. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. One of the most insidious habits affecting cardiovascular health, particularly in older adults, is the seemingly innocuous act of watching television or scrolling on a smartphone or tablet just before bedtime. While this ritual may feel like a harmless way to unwind, the blue light emitted by these screens has far-reaching effects beyond simply disrupting sleep. Blue light suppresses the production of melatonin, the hormone responsible for regulating sleep-wake cycles, but its impact doesn't stop there. It also stimulates the release of cortisol, the body's primary stress hormone, which primes the body for alertness and action. This hormonal shift is particularly pronounced in individuals over 60, whose physiological systems are more sensitive to such disruptions. The result is a cascade of cardiovascular consequences: elevated blood pressure, increased heart rate, and a state of heightened arousal that persists even after the screen is turned off. The brain, misled by the artificial light, interprets the environment as daytime, keeping the body in a state of vigilance. Meanwhile, the heart, instead of entering a restorative mode during sleep, remains in a subtle fight-or-flight state, placing unnecessary strain on the cardiovascular system. Over time, this chronic overstimulation can contribute to hypertension, arrhythmias, and even structural changes in the heart. Another critical but often overlooked mistake is going to bed soon after eating a meal. Consuming food, particularly heavy or nutrient-dense meals, within 2 hours of lying down intensifies the digestive process, which demands significant blood flow to the stomach and intestines. This redistribution of blood diverts resources away from other vital organs, including the heart, and can lead to nighttime palpitations, especially in individuals with pre-existing cardiovascular conditions such as coronary artery disease or heart failure. The effects are compounded in older adults, whose digestive and circulatory systems are less efficient. A pivotal study published in the Journal of Clinical Hypertension found that individuals over 60 who eat less than 2 hours before bedtime face a 2.5 times higher risk of nocturnal hypertension, a condition characterized by elevated blood pressure during sleep. This is particularly concerning because nocturnal hypertension is a strong predictor of adverse cardiovascular events, including heart attacks and strokes. Late dinners, especially those high in salt, fat, or protein, exacerbate fluid retention and increase cardiac workload, further elevating the risk of nighttime blood pressure spikes. Posture during sleep is another subtle yet significant factor influencing heart health, particularly for older adults. Many seniors gravitate towards sleeping on their right side, often because it feels more comfortable or intuitive. However, for those with conditions like congestive heart failure or atrial fibrillation, this position can exacerbate symptoms. Sleeping on the right side may compress the vena cava, the large vein responsible for returning blood to the heart, and cause subtle shifts in the heart's anatomical position within the chest. These changes can disrupt the heart's ability to maintain stable rhythms, leading to palpitations or worsening arrhythmias. While younger individuals may not notice these effects, aging hearts are far more sensitive to even minor positional changes during rest. In contrast, sleeping on the left side has been shown to optimize circulation, reduce pressure on the heart, and facilitate better lymphatic and venous drainage. A study published in the American Journal of Cardiology demonstrated that heart patients who slept on their left side experienced fewer nighttime arrhythmias and more stable heart rates compared to those sleeping on their right side or back. Another surprisingly common mistake is failing to empty the bladder before bed, a habit that may seem trivial but carries significant cardiovascular consequences. For older adults, an unemptied bladder can lead to fragmented sleep, abrupt awakenings, and sudden spikes in blood pressure. When the urge to urinate forces someone to rise quickly from deep sleep, the body undergoes a rapid postural change, triggering a surge in adrenaline and heart rate. In seniors with weakened vascular tone or autonomic dysfunction, this transition can cause dangerous fluctuations in blood pressure, increasing the risk of falls, fainting, or even cardiovascular events. Some cardiologists now recognize this as a hidden stressor for the aging heart, particularly in those with hypertension or heart failure. To mitigate this risk, individuals should make a habit of using the bathroom immediately before bed and avoid excessive fluid intake in the hours leading up to sleep. Even the height and positioning of a pillow can play a critical role in cardiovascular health during sleep. A pillow that is too low can cause the airways to narrow, leading to snoring or mild obstructive sleep apnea, both of which force the heart to work harder to maintain adequate oxygen levels. Conversely, a pillow that is too high can alter the alignment of the neck and upper spine, potentially compressing blood vessels and disrupting cerebral circulation. This misalignment may contribute to nighttime arrhythmias or transient ischemic events in susceptible individuals. Proper head elevation, typically achieved with a medium-firm pillow that supports the natural curve of the neck, is not merely a matter of comfort but a form of cardiovascular hygiene. It ensures optimal airway patency and circulation, reducing the heart's workload during sleep. A lesser-known but equally important factor is the impact of sleeping position on lymphatic drainage and fluid dynamics. Lying flat on the back, particularly after a salty or high-sodium meal, can promote fluid retention in the tissues, increasing cardiac preload, the volume of blood the heart must pump with each beat. For individuals with borderline heart function, such as those with early-stage heart failure, this subtle increase in preload can push the heart toward overload, leading to symptoms like shortness of breath, swelling, or fatigue upon waking. The heart, instead of resting, spends the night managing excess fluid, which can manifest as morning lethargy, anxiety, or a sensation of heaviness. Elevating the head and upper body slightly, using an adjustable bed or extra pillows, can counteract this effect by promoting better fluid drainage and reducing strain on the heart. The cumulative danger of these habits lies in their insidious nature. Unlike acute events like a heart attack, the symptoms of these nightly stressors are subtle and build gradually. A bit more fatigue in the morning, slightly elevated blood pressure at a routine checkup, occasional chest discomfort mistaken for indigestion, or restless sleep dismissed as normal aging. Over weeks, months, or years, however, these seemingly minor mistakes compound, silently reshaping the heart's rhythm, structure, and resilience. By the time significant symptoms emerge, the cardiovascular system may already be compromised, with reduced capacity to handle stress or recover from exertion. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. The good news is that these risks are not inevitable, and their effects can be reversed without relying on medications. Simple, intentional adjustments to nightly routines can profoundly reduce cardiovascular stress, stabilize blood pressure, and allow the heart to enter a true state of rest during sleep. The first and most impactful step is to establish a structured pre-sleep, cool-down period. This involves setting aside a consistent 60 to 90-minute window before bed during which all high-stimulation activities are avoided. This means no smartphones, tablets, computers, or television screens, as well as steering clear of emotionally charged conversations or stressful tasks. Instead, dim the lights, engage in calming activities like reading a physical book, listening to soft music, or practicing gentle stretches, and focus on slow, deliberate breathing. Research from Harvard's Division of Sleep Medicine demonstrates that a predictable pre-sleep routine significantly lowers resting heart rate, enhances parasympathetic nervous system activity, responsible for rest and repair, and promotes deeper, more restorative sleep. Meal timing is another critical adjustment. To minimize digestive strain on the heart, aim to finish your last meal at least 3 hours before bedtime, particularly if the meal includes salt, fat, or protein, which require more intensive digestion. Opt for lighter, easily digestible foods in the evening, such as steamed vegetables, whole grains, lean proteins, or broth-based soups. These choices allow the stomach to process nutrients fully before sleep, reducing the demand for blood flow to the digestive system and enabling the heart to focus on recovery rather than compensation. For individuals prone to acid reflux, eating earlier also minimizes the risk of gastric contents pressing against the diaphragm, which can mimic or exacerbate cardiac symptoms. Hydration balance is another silent but powerful tool for supporting heart health during sleep. Many older adults either underhydrate, leading to dehydration and increased blood viscosity, or overhydrate in the evening, resulting in frequent bathroom trips that disrupt sleep. The optimal approach is to hydrate steadily throughout the day, aiming for consistent water intake that supports blood volume and kidney function without overwhelming the system. In the 2 hours before bed, limit fluid intake to small sips as needed, and avoid diuretic beverages like alcohol or caffeinated tea, which can increase urine production and dehydration risk. Proper hydration reduces the likelihood of blood clots, eases the heart's workload, and helps maintain stable blood pressure overnight. Sleeping position is a simple yet transformative factor. While sleeping on the back may seem neutral, it often exacerbates snoring, airway obstruction, and fluid redistribution, all of which strain the heart. Sleeping on the left side, however, optimizes circulation, reduces pressure on the heart, and facilitates better lymphatic drainage. For those with orthopedic issues, such as hip or back pain, placing a pillow between the knees or under the legs can maintain spinal alignment while supporting left-side sleeping. This small adjustment can have a profound impact, particularly for older adults with cardiovascular vulnerabilities. Bedroom temperature also plays a pivotal role in cardiovascular health. A cooler environment, ideally between 60 and 67 degrees Fahrenheit, promotes vasodilation, the widening of blood vessels, which lowers blood pressure and allows the heart to maintain stable rhythms. Warmer temperatures, by contrast, can increase heart rate, cause sweating, and disrupt sleep quality, all of which place additional strain on the cardiovascular system. Using breathable bedding, keeping windows slightly open, or employing a fan can help maintain an optimal sleep environment. Breath control techniques offer another accessible strategy for reducing cardiovascular stress before bed. Practicing slow, diaphragmatic breathing, aiming for 5 to 6 breaths per minute, stimulates the vagus nerve, which activates the parasympathetic nervous system and promotes a rest and digest state. This simple habit, supported by multiple peer-reviewed studies, has been shown to reduce nighttime palpitations, lower blood pressure, and enhance sleep depth, particularly in older adults with mild hypertension or anxiety. Incorporating this practice into the pre-sleep routine, even for just 5 minutes, can create a measurable shift in heart rate variability and cardiovascular coherence. For individuals who struggle with pre-sleep anxiety or racing thoughts, common triggers for blood pressure spikes, gentle physical rituals like low-intensity stretching or floor-based yoga can be transformative. These activities are not about exercise but about signaling to the body that it's safe to relax. Movements like child's pose, seated forward folds, or leg stretches release muscle tension, calm the nervous system, and promote a sense of grounding. Studies have shown that such practices reduce heart rate variability and improve blood pressure regulation, particularly when performed consistently as part of a nightly routine. Finally, the type of lighting used in the evening has a profound effect on cardiovascular recovery. Exposure to blue-white light from LEDs, screens, or overhead fixtures suppresses melatonin production and heightens alertness, delaying the natural drop in blood pressure that occurs during sleep onset. Switching to warm, amber-toned lighting, such as a bedside lamp with a low-wattage bulb, signals to the brain that it's time to wind down. This shift supports the body's circadian rhythm, accelerates the transition to restorative sleep, and facilitates cardiovascular relaxation. Each of these adjustments, screen avoidance, meal timing, hydration balance, sleeping position, room temperature, breathing techniques, gentle movement, and lighting, may seem minor in isolation. However, when combined, they create a synergistic effect that transforms the sleep environment into a sanctuary for cardiovascular recovery. Instead of battling overstimulation, digestive strain, fluid imbalances, or positional stress, the heart can enter a state of true rest, allowing it to repair, stabilize, and strengthen. Over time, the benefits accumulate: lower blood pressure, fewer arrhythmias, deeper sleep, and a more resilient cardiovascular system. For older adults, these changes are not just about improving sleep, they're about reclaiming the body's natural ability to heal and thrive night after night. The night is intended to be a period of profound restoration, a time when the body rejuvenates and repairs itself for the demands of the day ahead. However, for many individuals over the age of 60, this restorative process is disrupted, particularly for the heart, which struggles to recover from the stresses it endures. What is particularly alarming is that the most critical warning signs of this cardiac strain often manifest not during the night itself, but within the first 15 to 30 minutes after waking. Cardiologists refer to this window as the cardiac transition zone, a precarious period when the body shifts from the low-energy state of sleep to the heightened alertness of wakefulness. During this delicate transition, the heart is uniquely vulnerable, and it is when the majority of silent heart attacks, arrhythmic episodes, and dangerous blood pressure spikes occur, often with symptoms so subtle that they fail to trigger immediate concern. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. The subtle warning signs. The first and most prevalent warning sign is unexpected fatigue upon waking. This isn't the typical grogginess that dissipates with a cup of coffee. It's a deep, lingering exhaustion that persists well beyond breakfast. Many people attribute this to poor sleep quality, aging, or simply not being a morning person. However, this type of tiredness can signal that the heart has been working overtime during the night, battling challenges such as high blood pressure surges, low oxygen levels, or impaired circulation. When the heart is under strain, it struggles to deliver adequate oxygen and nutrients to tissues, hindering the body's ability to regenerate cells effectively during sleep. This results in cardiovascular exhaustion, a condition that, if recurrent, is far from normal and warrants attention. Another critical indicator is morning dizziness or lightheadedness, particularly when rising from bed. This sensation often stems from orthostatic hypotension, a sudden drop in blood pressure caused by the cardiovascular system's delayed response to postural changes. In older adults, the aging heart and blood vessels may struggle to adapt quickly enough to pump sufficient blood to the brain when transitioning from lying down to standing. While this symptom may seem fleeting or benign, it can be a red flag, especially since it is often preceded by a night of subtle heart rate irregularities or mild oxygen desaturation that goes unnoticed during sleep. Morning headaches, particularly those characterized by a heavy, pressing sensation around the temples or at the base of the skull, are another warning sign that should not be dismissed. These headaches may indicate nocturnal hypertension, a condition in which blood pressure fails to follow its normal nighttime dip or, in more severe cases, spikes during sleep. This silent elevation in blood pressure places relentless stress on the arteries, contributing to progressive damage over time. One of the long-term consequences is left ventricular hypertrophy, a thickening of the heart's main pumping chamber that significantly increases the risk of heart failure, stroke, and other cardiovascular complications. Swelling in the feet, ankles, or fingers upon waking is another subtle but significant clue. This puffiness, known as edema, often results from overnight fluid retention caused by poor venous return and reduced cardiac output. When the heart's pumping efficiency is compromised, it struggles to circulate blood effectively, allowing fluid to pool in the tissues, particularly in the lower extremities due to gravity. This swelling may subside as the day progresses, leading many to dismiss it as a minor inconvenience. However, consistent morning edema is a sign that the heart is not functioning optimally and should be investigated. Pay close attention to your breathing patterns in the morning. Waking up with shortness of breath, a need to sit upright to breathe comfortably, or a sensation of chest tightness could point to paroxysmal nocturnal dyspnea, a condition where fluid backs up into the lungs due to diminished heart efficiency. This symptom isn't always dramatic. It can manifest as a creeping discomfort that builds gradually over weeks or months. In more severe cases, individuals may wake gasping for air, coughing, or feeling an urgent need to open a window. These episodes, particularly when they occur while lying flat, are strong indicators that the heart's ability to manage fluid dynamics is faltering. The heart rate itself provides vital clues during the morning transition. Upon waking, a healthy pulse should be steady, calm, and within a normal range, typically 60 to 100 beats per minute for most adults. However, if you notice a pounding heart, irregular rhythm, or rapid pulse, especially in the absence of stress, anxiety, or a vivid dream, this could reflect nocturnal arrhythmias. Conditions like atrial fibrillation, a common irregular heartbeat, often begin during sleep and may remain undetected until the individual stands up and feels a fluttering or racing sensation in the chest. These episodes, if frequent, can increase the risk of stroke and heart failure. Nocturia, or the frequent need to urinate at night, is another often overlooked symptom with cardiovascular implications. While commonly attributed to bladder issues, prostate enlargement, or excessive evening fluid intake, nocturia can be a subtle sign of heart failure. During the day, a struggling heart may allow fluid to accumulate in the lower body due to poor circulation. When lying down at night, this fluid is redistributed into the bloodstream, overwhelming the kidneys and triggering frequent urination. This compensatory mechanism is a warning that the heart's pumping capacity is compromised. Even seemingly minor symptoms like a dry cough or sore throat upon waking can have cardiovascular roots, particularly if accompanied by snoring. While snoring is often dismissed as a mere annoyance, it may indicate obstructive sleep apnea, a condition where the airway repeatedly collapses during sleep, causing intermittent drops in oxygen levels. Each episode triggers a stress response, releasing adrenaline, constricting blood vessels, and elevating heart rate and blood pressure. Throughout a single night, these disruptions can occur dozens or even hundreds of times, placing immense strain on the heart and contributing to long-term cardiovascular damage. The opportunity for intervention. The good news is that the morning offers a unique window to intervene and support your heart's recovery from the stresses of the night. The first 30 minutes after waking are particularly critical for resetting the cardiovascular system and mitigating any residual strain. By adopting simple, non-medical strategies, you can protect your heart, improve circulation, and reduce the risk of further damage. Here are some practical steps to incorporate into your morning routine. 1. Ease into wakefulness. Resist the temptation to leap out of bed immediately. Instead, take 30 to 60 seconds to sit upright slowly on the edge of the bed, breathing deeply and allowing your circulation to stabilize. This gentle transition reduces the cardiovascular shock associated with sudden posture changes, helping to prevent dizziness, fainting, or blood pressure drops, especially in those with orthostatic hypotension. 2. Stimulate circulation. Before brushing your teeth or starting your day, perform a brief round of gentle ankle and wrist rotations. These simple movements promote blood flow through the extremities, sending a wake-up signal to your vascular system. For older adults, this practice also helps reduce the risk of early morning blood clots, a known concern for those with sedentary sleep patterns or conditions like peripheral artery disease. 3. Hydrate strategically. Drinking a full glass of room-temperature water within the first 15 minutes of waking is one of the simplest yet most effective ways to support your heart. Overnight dehydration thickens the blood, increasing its viscosity and placing additional strain on the heart. A morning glass of water helps thin the blood, supports kidney function, and counteracts the natural dehydration that contributes to blood pressure spikes and cardiac stress. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 4. Leverage temperature. A quick rinse of your face or the back of your neck with cold water can activate the vagus nerve, a key regulator of heart rate and nervous system balance. This technique, used in emergency medicine to manage irregular heart rhythms, can be incorporated into your daily routine to lower your resting heart rate and promote calm. It's a free, accessible habit with immediate benefits. 5. Practice breathing awareness. Dedicate 2 minutes to slow, nose-based breathing upon waking. Inhale for 4 seconds, hold for 2 seconds, and exhale for 6 seconds. This technique, known as diaphragmatic breathing, resets the body's stress response, improves oxygen delivery, and enhances heart rate variability, a key marker of cardiovascular health and longevity. Studies have shown that consistent practice can lower morning blood pressure and improve overall cardiac resilience. 6. Embrace natural light. Exposing your eyes to natural sunlight within the first hour of waking helps regulate your circadian rhythm, balance melatonin production, and lower daytime blood pressure. Even 5 to 10 minutes spent near a window, on a balcony, or outdoors can signal to your body that it's time to stabilize and prepare for the day. This practice also supports hormonal balance, which plays a critical role in cardiovascular health. 7. Try grounding. If you have access to grass, sand, or natural soil, consider standing barefoot for a few minutes in the morning. Known as grounding or earthing, this practice may help discharge accumulated stress and reduce inflammation markers, according to preliminary research. While more studies are needed to fully validate its cardiovascular benefits, grounding is a safe, cost-free ritual that often promotes a sense of calm and well-being. When to seek medical attention. For those experiencing consistent morning symptoms, such as chest tightness, swelling, dizziness, shortness of breath, or chronic fatigue, it's critical not to dismiss them as just aging or normal. These signs, even if mild or intermittent, may represent the heart's earliest warnings of underlying dysfunction. To stay proactive. Track your symptoms. Keep a journal of any morning symptoms, noting their frequency, duration, and intensity. For example, record episodes of fatigue, dizziness, swelling, or irregular heartbeats, along with any potential triggers, e.g., poor sleep, stress, or dietary factors. Seek evaluation. If any of these symptoms occur more than twice a week or worsen over time, consult a healthcare provider, preferably a cardiologist. Diagnostic tools such as an electrocardiogram, ECG, echocardiogram, blood pressure monitoring, or sleep study can help identify issues like nocturnal hypertension, arrhythmias, or sleep apnea. Don't wait for a crisis. Many cardiovascular conditions progress silently for years before causing a major event like a heart attack or stroke. Early intervention, whether through lifestyle changes, medication, or medical procedures, can prevent irreversible damage and improve quality of life. So, what have you learned today about protecting your heart while you sleep? From simple tweaks like avoiding screens before bed to adjusting your sleeping position, these small changes can make a massive difference in your cardiovascular health, especially if you're over 60. We want to hear from you. Comment below with one thing you've learned from this video that you'll start practicing in your life to keep your heart strong. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more science-based tips to transform your health.